Hello, and welcome to our module titled Special Healthcare Needs, Child Welfare, and Vital Involvement, When Things Go Well. This presentation was developed by Helen Kivnick and Courtney Kellerman-Wells. Helen is trained and licensed as a clinical psychologist and has since worked for over 30 years in practice, programming, research, and teaching concerning the promotion of healthy life cycle development, the arts, and intercultural relations. She is currently a professor of social work at the University of Minnesota, and she lectures both nationally and internationally on these topics. She has spearheaded the development of vital involvement practice, which is used to optimize personal vitality and community engagement among people across a variety of settings, populations, and stages of the life cycle. Courtney is currently a third-year PhD student in the School of Social Work at the University of Minnesota. Courtney is passionate about improving the lives of young people living with chronic and terminal illness through community practice, research, and teaching. Her specific interests include grief and loss, adolescent identity development, resiliency promotion, and training healthcare professionals. Courtney currently does research in the School of Social Work with Helen Kivnick, as well as at the University of Minnesota Medical School, and is an adjunct professor in the psychology department at St. Catherine University. The case study we are presenting today came about through years of casual interaction between Helen and this family. The parents fostered and then adopted children who were both diagnosed as failure to thrive in infancy and who both seemed to be making far more and far quicker developmental progress than one might expect given the circumstances of their earlier lives. After informally observing this family change and grow, Helen wanted to understand the positive family characteristics that promoted such healthy development in these two high-risk children. The family's positive story becomes clear when viewed in terms of the construct of vital involvement, which emphasizes the interactions between strengths, supports, and disorders and challenges in individual, family, and community functioning. Therefore, this presentation will explore the strengths and supports that promote well-being in the adopted children in this one family. We will primarily focus on parenting and family dynamics. We caution viewers to recognize that there is far more complexity to the story than we can discuss in this one presentation. This presentation has three aims. We will be exploring the strengths and supports of one family that is successfully raising fostered and adopted children with special needs. We will use the construct of vital involvement to identify meaningful interactions between this family and elements of their environment, and we will model how vital involvement in life domains can be used to assess and promote well-being. We will accomplish these aims by situating our project in the necessary background and conceptual information, presenting the story of the Johnson family, the name has been disguised, and highlighting our key findings, while also discussing implications of these findings for child welfare work. Background and central concepts. This project concerns children with special healthcare needs who are involved with child welfare system. Who are these children? What demands do their needs place on families and workers in the child welfare system? Children with special healthcare needs are those who have or are at increased risk for a chronic, physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. It is estimated that around 15% of all U.S. children under the age of 18 live with some sort of special healthcare need. However, for children involved in any way with the child welfare system, 50 to 90% are estimated to have special healthcare needs. That is, children in the child welfare system are 3 to 6 times more likely to have special healthcare needs than their peers in the population at large. Despite our knowledge that children involved in the child welfare system have more health problems, we know relatively little about how to promote healthy development in these children and their families. Over the past 2 decades, child welfare leaders and administrators have called for a shift in the profession's focus, from permanency and safety and towards child well-being. However, the concept of well-being is not clearly defined in the child welfare literature. Therefore, child well-being is very difficult to assess and promote. The Administration on Children, Youth, and Families describes well-being as developmentally appropriate, daily healthy functioning in 4 domains: cognitive, physical, behavioral/emotional, and social. However, this description fails to operationalize or tell us what developmentally appropriate healthy functioning looks like in any of these four domains. This definition also does not take into account the child or family's definitions of their own well-being. Neither does it provide a conceptual basis for assessing the strengths and challenges facing an entire family system. Due to this incomplete understanding of well-being in child welfare clients, we introduce the construct of vital involvement as a supplementary conceptual framework for understanding what well-being looks like across life domains, considering a child's and family's personal definitions and experiences of well-being, and assessing individual and family well-being by understanding strengths and challenges facing a family system and its individual members. So what is vital involvement? Vital involvement is defined as the process of a person being in meaningful relation to his or her external environment and as being engaged in whatever he or she finds meaningful. Here we are defining meaningful as anything that has significance, importance, or purpose to a particular person, and engagement as involvement or participation in an activity or relationship. Vital involvement is essential to the psychosocial development that takes place in all of us at every stage in the life cycle without our paying conscious attention, from infancy through old age. This construct was introduced and defined by Erickson, and Kivnick in their book Vital Involvement in Old Age. This slide illustrates vital involvement's reciprocal interaction between person and environment. Each person brings their own strengths and problems, such as empathy or learning disabilities, to environmental situations such as school, work, or family holidays. At the same time, the environment is supporting or obstructing the person's strengths and problems socially or physically. For example, a responsive, attuned parent can support a child's exercising and strengthening empathy and can utilize this empathy in helping the same child overcome learning disabilities. By contrast, an overstretched teacher is unfortunately likely to criticize the child's expressions of empathy as talking out of turn and to misinterpret learning disabilities as poor academic performance due to lack of attention. That is, the environment provides both supports and obstacles that influence how and to what extent one is able to utilize internal strengths to become vitally involved with the world. Both environment and individual are simultaneously evolving and reciprocally influencing each other. The diagram on this slide constitutes a tool that can be used to assess the contents of an individual's domains of vital involvement. 4 domains are represented here: personal challenges, personal strengths, environmental strengths and supports, and environmental challenges. Domains 3 and 4 constitute domains of well-being, and domains 1 and 2 constitute domains of ill-being. We all experience life in all 4 domains. Healthy development is a matter of balance. We can collect information from an individual or family in each domain, and then use that information in planning with clients and evaluating their progress. This tool facilitates discussion of a client's challenges and strengths and supports, provides documentation of these characteristics, and aids in strategizing about next steps. Here, we have added the vital involvement arrows to emphasize the way meaningful engagement between person and environment is a constant and reciprocal process. Identifying challenges and strengths is a crucial step in promoting well-being. Optimizing vital involvement also requires consideration of how the 4 domains are influencing each other. Now that we've discussed the background information and conceptual foundations for this project, we will describe our project and its key findings. As we move through these slides, we will be using the 4 domains described in the previous 2 slides to identify personal and family strengths and challenges in our case study of the Johnson family. We began this project wanting to understand and learn from a remarkable family that Helen had previously worked with. This family fostered and then adopted 2 children who were severely neglected from before birth. One came into foster care weighing 11 pounds at 9 months, and the other had failed to thrive for only 2 months before entering foster care. Since knowing this family, Helen had observed that the children were demonstrating many elements of healthy development and tremendous growth, despite their difficult beginnings. We rarely see such healthy development and growth in fostered and adopted children with serious early challenges. We sought to understand this positive development in terms of vital involvement as a way to help child welfare workers and other families promote optimal well-being in their children with special health care needs. Another reason we chose this particular family as an exemplar is that they are stable and high functioning. These strengths mean that it was relatively easy for us to isolate our exploration of the parenting of their two children with special healthcare needs. In other words, this family demonstrates relatively few confounding difficulties that confront many foster or adoptive families. The mother in this family graciously agreed to participate in our study and to share her time and voice with us as a window into her family's experience. She participated in 3 separate face-to-face interview sessions for a total of 5 hours. We then immersed ourselves in the family's story and considered the family's strengths and challenges by viewing their characteristics in the 4 domains. During this process, we explored characteristics of individual family members as well as the family as a whole. To enrich the telling of the family story, we have given the family a fictitious last name and given each family member a fictitious first name, and otherwise disguise potentially identifiable family details. In 2000, Sarah and Gabe were married and tried to have children biologically. They were unsuccessful, but knew they wanted to be parents. Over the next couple of years, the couple decided to foster and/or adopt children with special needs, specifically emotional or behavioral. In 2004, the couple became involved in the child welfare system by doing respite and foster care. Shortly after entering into this new world, they received a call from their county social worker stating that a 9-month-old child needed to be removed from her home that week. They were told that this young child had been diagnosed as failure to thrive, weighed only 11 pounds, and would likely not be returning to her biological home. The couple made a life-changing decision in a few days, and the child arrived in their home 3 days later. When she arrived, April was tiny, completely unresponsive, and had a feeding tube. At this point, Sarah quit her job and decided to stay home full-time to care for April. 3 months later, April's biological parents signed away her rights, and Sarah and Gabe filed adoption paperwork. During this process, Sarah and Gabe found out that April's biological mother had recently given birth to another child who was also likely to be removed from the parents. After some back and forth between the hospital and the biological parents' home, Evan arrived at Sarah and Gabe's home just 7 months after April, also with a diagnosis of failure to thrive. Within a few weeks of placing Evan, his biological parents signed over their rights, and Sarah and Gabe filed adoption paperwork for Evan as well as his older sister. Less than 1 year after April's arrival, and 3 months after Evan's, Sarah and Gabe legally became the parents of 2 children with significant special healthcare needs. This slide emphasizes how quickly these life-changing events happened for this family. Within 1 year, Sarah and Gabe fostered and then adopted April and Evan. Here, we summarize the key elements of the Johnson family story. Currently, their family consists of mom, Sarah, dad, Gabe, daughter, April, who is now 8 years old, and son, Evan, who is now 7. Both April and Evan were fostered and then adopted from the same biological family. Both children were diagnosed as failure to thrive in infancy and were removed from their biological home due to neglect and abuse. And both children currently have chronic physical, emotional, and cognitive health conditions related to their early neglect and abuse. Now we will return to the 4-domain SCAN tool to explore the most prominent challenges and strengths of the Johnson family. We represent the figure from slide number 15 as a visual reminder of the tool. Personal challenges of the Johnson children and their family, Domain 1. The major personal challenges facing this family are the physical, emotional, and cognitive conditions experienced by April and Evan. These include their early diagnoses and experiences of failure to thrive and inability to eat, current diagnoses of consequent brain damage, which manifests as a lack of focus and inability to sit still, recent struggles with anger and anxiety, continuing difficulty eating and maintaining healthy weights, asthma and the need for its persistent care. Not surprisingly, the family faces challenges related to the ongoing coordination and management of these medical and emotional issues. In particular, parents must coordinate the children's appointments, prescriptions, and services. Recently, both of the kids have had increasing struggles with emotional and cognitive problems as they grow and mature. Environmental challenges, Domain 2. Sarah emphasized 3 main environmental challenges during our interviews. The first is the overwhelming intrusiveness and complexity of the child welfare system. From the instant April arrived at their home, she found professionals coming and going at all times of the day and night. Although Sarah and Gabe got used to this relatively quickly, they always felt frustrated by how little control they had over the situation, and they never fully understood why all these people had to keep coming to their home. Sarah stated that throughout the year before adoption, she never figured out who coordinated all the services and how people knew to show up at their home. The second major challenge has been the lack of coordination between the child welfare system and the medical system. Although Sarah didn't have to coordinate the child welfare services, she did have to make sure that her children were receiving the necessary medical care, and it wasn't always clear what she was going to have to do and what the child welfare system was going to do. And sometimes she would receive care from the county that was ineffective, which then forced her to seek out private providers for the same care. The family's final ongoing challenge is how difficult it has been to find professionals to provide high-quality care that meets the needs of their family and their children. Sarah told many stories of personal care attendants or occupational therapists who would come into their home and tell her all the things she was doing wrong and disrespect the rules and boundaries they'd set in their home for their children, such as stable meal times or no TV. Personal strengths, Domain 3. The family's many personal strengths indicate some of what has enabled them to promote the children's well-being in the midst of their many challenges. This slide identifies some of the key strengths of the parents and family. There is no question that Sarah and Gabe wanted these children. Although the placements happened quickly and their entire life changed in a matter of days, they have dedicated their lives to parenting these two children. They are incredibly persistent. Whether we're talking about administering medications, setting boundaries, or telling the kids how much they love them, these parents are on top of things from the minute they get up to the minute they go to bed. A prominent theme kept resurfacing in Sarah's conversation was her ability to trust her gut instincts. Although she wasn't sure what direction it was taking her, she quickly became good at knowing when things weren't quite right. Most often she discussed this in the context of healthcare providers ignoring the parents, when they knew something was wrong with their children. Over time, Sarah realized that when she trusted her gut, she ended up being right. This realization gave her confidence to go against what professionals were telling her. She told many stories of providers sending the children home from the clinic or urgent care saying that everything was fine, only for them to end up in the emergency room several hours later with a life-threatening condition. After this happened once or twice, she began to stand her ground and demand that her children receive the care she knew they needed. Clearly trusting her gut, developing an increasingly reliable gut, and gaining confidence have contributed to Sarah and Gabe's skills as parents. Going into this experience, neither of them had had children, but they quickly learned the parenting ropes and embraced their newfound roles as both caregivers and advocates for their children. Another theme of strength was Sarah and Gabe's need for and ability to ask for help. Even though they quickly picked up skills and confidence, they just as quickly realized that they weren't going to be able to raise these kids by themselves. The enormous amount of time and energy required to care for April and Evan from the beginning made it a necessity for the family to reach out to family, friends, and their community. Their church in particular has been a key support system for the family. From the beginning, the family's financial and cognitive means have been a major strength. Although not wealthy, Sarah and Gabe did welcome the kids into their life after they were already established in a home and careers. This stability and the family's resulting job flexibility allowed Sarah to quit her job as soon as April arrived and stay home until both children went to school full-time. Another aspect of the family's interactions, which has likely been crucial to the kids' positive emotional development, is Sarah and Gabe's openness and honesty. From the beginning, they have talked with the kids about their adoption and special needs. One of the ways they do this is by celebrating important milestones every year. For example, when April got her feeding tube out at age 6, the family went to Disney World, and now every year on that day, they have a little party to celebrate the significance of that event. As a matter of course, Sarah and Gabe have high and consistent standards for their family's behavior. For instance, they do not have a TV in the house, they have regular meal times where they all eat together, and they spend as much time outdoors as possible. Perhaps Sarah and Gabe's most important parenting strength is their recognition that each of their kids has a unique developmental trajectory. They try hard not to compare the kids, especially when it comes to schoolwork. They openly discuss frustrations that arise when the kids compare themselves to their peers. Environmental strengths and supports, Domain 4. Although many of these strengths are related to the personal strengths already discussed, mentioning them again illustrates the importance of interaction between personal and environmental domains. The community where the Johnson family lives has been a tremendous source of informal support. They regularly receive physical help, meals, clothes, babysitting from this community. Sometimes even more important, they receive emotional support that has kept them moving forward when things have been really tough. Also, with time and admirable persistence, the family has found a handful of professionals whom Sarah refers to as her angels. Sarah says very firmly that she and Gabe could not be raising these kids without the supports, services, devices, and wisdom of these diverse professionals. Now that we've explored some of the strengths, supports, and challenges present in this family system, we will consider ways that these domains interact to promote vital involvement and well-being. In this slide, the vital involvement arrows have been superimposed on the 4 domains to emphasize the reciprocal interaction continuously taking place between the person and their environment. Since life occurs in all 4 domains simultaneously, it is essential to consider the interactions that are or could be taking place between the strengths, supports, and challenges, and between person and environment. In this family, vital involvement is happening in moments where family members use their strengths to counterbalance, grapple with, and overcome problems and challenges. If we think of this process in terms of well-being, we can essentially say that at any particular point in time, this family is experiencing well-being when their vital involvement supports the effective use of strengths to counterbalance challenges. Let's look explicitly at how the Johnson family uses particular strengths to address specific challenges to illustrate what this part of the vital involvement process looks like. Please keep in mind that this illustration and explanation are oversimplified for the purpose of clarity. This slide presents some signature strengths and challenges confronting this family. Signature personal problems include the kids' physical and emotional conditions or special healthcare needs, such as failure to thrive, inability and reluctance to eat, problems maintaining healthy weight, new emotional problems with maturation. April and Evan came to Sarah and Gabe because their early failure to thrive associated with inability to eat. As they have grown and matured, the physical inability to eat has yielded to primarily emotional reluctance to eat, resulting in ongoing problems maintaining healthy nutrition to support a healthy weight. Both children are displaying normative developmental issues associated with maturation, coupled with exacerbation of these issues by residues and consequences of early conditions. Signature environmental challenges include lack of systematic coordination between the child welfare system and medical system. Early on, simply coordinating appointments and visits with county social workers, public health nurses, doctors, physical therapists, home services, and everyday family activity schedules was daunting. For example, social workers simply showed up when they could arrange time, regardless of April and Evan's regular meal times or out-of-home medical or therapy appointments. Additionally, professionals sometimes provided misinformation, conflicting advice, or instructions. For example, when April arrived, a public health nurse showed Sarah and Gabe how to use the feeding tube and its associated pump. A few hours after she left in the middle of the night, the apparatus started beeping. Sarah and Gabe followed the nurse's instructions, but the beeping continued. Signature personal strengths include parents highly motivated to care for children, parents persistent and committed, parents embrace advocacy role, parents have cognitive and financial means, parents recognize kids' unique developmental trajectory, and family standards for child care behavior, such as regular mealtime and regular bedtimes. From the beginning, Sarah and Gabe were highly motivated to parent children well. They were extremely proactive and persistent, first in gaining legal custody of April, and then in doing the same for Evan, and next in effectively adopting both children. These processes required them to advocate for the children's well-being to a variety of social service, legal, and medical entities. Effectively, Foster parenting April required them to quickly master the operation of temperamental feeding equipment, medication schedules, and the process of essentially sharing daily responsibility for their daughter with a changing cast of outside professionals and aides. Their cognitive and advocacy abilities led them, on the first night when the feeding apparatus malfunctioned, to find the label and contact information for the equipment provider, call the 24-hour phone number, and stay on the line until they were sure both they had resolved the immediate problem and that they better understood what to expect from the equipment and how to deal with possible difficulties. It turned out that the public health nurse had provided misinformation when giving them the equipment. Sarah and Gabe established strict standards for childcare and behavior. Family mealtimes and children's bedtimes have always been consistent and regular, since they know that such regularity and routines are important bases for a child's development of trust in people and the environment. When April first arrived, she was behaviorally and emotionally non-responsive. After several months, she finally started to cry. Sarah realized that this crying indicated for April healthy emotional development and that she needed to support this progress in her daughter, responding with attention, concern, and comfort rather than follow conventional advice to ignore most crying at that age as a way of discouraging it. Signature environmental strengths include a strong sense of community, such as church and family, and high-quality, personable professionals, such as personal care attendants. When April and Evan arrived, Sarah and Gabe's church community threw them a welcome or baby shower type party, where they welcomed the children into the church community. Sarah and Gabe shared the children's stories with members of the community. They experienced an outpouring of warmth and concern from this community. The mountains of gifts provided for Sarah and Gabe the same kinds of support, connection, and sense of backup that such gifts offer to all new parents. Sarah and Gabe also relied on their own extended family, who all live at a distance, for ongoing emotional support and advice. Family members visited frequently to meet both the kids and also enable the kids to come to feel comfortable and secure with each of them. By the time Sarah and Gabe felt comfortable taking a weekend by themselves away from home, April and Evan were entirely secure with Gabe's parents, coming into their home and staying with them for the weekend. Sarah learned to rely on competent, personable professionals, and to quickly dismiss those who were not. One personal care attendant would leave the house to smoke in her car, both temporarily leaving the children unattended and also bringing smoke into the house, which exacerbated both children's asthma. Another PCA demurred at using the feeding tube. Although Sarah felt bad about firing these people, rather than teaching them to improve their performance, she knew that now she needed to be an effective advocate for her children's needs. When she encountered competent professionals, in whatever capacity, she made deliberate efforts to express appreciation and maintain long-term contact. For instance, a high school student from church served as an early babysitter. Sarah has stayed in touch with this young woman throughout high school and into college. Sarah encouraged her to obtain PCA training and certification. The young woman now serves as a PCA for the family when she comes home from college. Now look at this slide again and push yourself to think about the ways Sarah and Gabe have used the specific strengths we listed in order to grapple with their parenting challenges. In your mind, draw arrows from each strength to the particular challenge or challenges it helps address. Notice that Sarah and Gabe use some strengths, such as persistence, advocacy, cognitive means, in addressing nearly every challenge. Notice too that some challenges are addressed by multiple strengths. Every person in any environment has personal and environmental strengths. Although child protection workers have a great deal of information about a child's or family's personal and environmental challenges, we pay far less attention to that same child's and family's personal and environmental strengths. This example illustrates a common sense principle that the more strengths we can identify that already exist in a client, the more we are likely to be able to help them recognize these strengths for themselves and think about how to use these strengths creatively in addressing challenges. While these thoughts about the domain scan tool and the connections between strengths and challenges are fresh in your mind, complete the following exercise in using the tool to describe and understand a sample person. Since you know a great deal about yourself and your own environment, we suggest that you use yourself as a sample person. This should take approximately 15 to 20 minutes. You will need to download the Vital Involvement Domain Scan tool from the opening page of the module to complete this exercise. We will begin by considering the characteristics in each domain. In Domain 1, list 3 to 5 problems, challenges, or obstacles that you can identify within yourself. In Domain 2, list 3 to 5 problems, challenges, or obstacles that you can identify in your social, physical, or organizational environment. In Domain 3, which is a little bit more fun, list 3 to 10 strengths, abilities, skills, values, or aspirations that you can identify within yourself. These are qualities that you can count on, skills and abilities that have served you well in your past, and goals and aspirations that motivate you. And in Domain 4, list 3 to 10 supports, strengths, positive features of your social, physical, organizational, or community environment. These are people you can count on and things you like about where you live and work. Community resources that you utilize or are grateful for. After listing out these characteristics in the 4 domains, now push yourself to think about how you already use several of these strengths in Domains 3 and 4 to address individual problems or challenges that appear in Domain 1 and 2. How might you use specific strengths to address particular problems that have not yet been resolved to your satisfaction? This process will essentially involve you in drawing conceptual arrows from specific strengths and back to particular problems. In these few minutes, you should see how this vital involvement process is working in your life, without you necessarily being consciously aware of it. Using strengths to counterbalance, grapple with, and overcome problems and challenges, using personal strengths to overcome environmental challenges, using environmental supports to overcome personal challenges. Adding consciousness and intention to this process greatly enhances the possibilities for progress. Even those clients who confront extremely serious problems and challenges are relying on strengths and supports to make it through everyday life. Helping them identify their strengths, especially those they may not recognize, gives both client and worker a realistic picture of their current domains and permits. This allows appropriate respect and self-esteem based on realistic strengths and accomplishments, introduction of environmental supports such as workers, devices, programs, knowledge to help address problems, and more intentional application of existing personal and environmental strengths in grappling with problems and enhancing existing strengths. Key findings and implications. Our exploration of this family's strengths and challenges illustrates ways that family system strengths and individual parent strengths, plus environmental supports, can enable foster and adoptive families with children with special healthcare needs to maximize healthy development, well-being, and vital involvement, and not simply to arrest deterioration and prevent additional problems. This family demonstrates vital involvement as they use their strengths to overcome challenges, the children's individual challenges, and environmental obstacles. This process of vital involvement has resulted in ongoing healthy development both for the children and also for the entire family. It is interesting to note that many of the family's strengths and supports come from outside the child welfare system, implying that families may have rich sources of untapped strengths and supports that are going unused. Child welfare workers could increase their effectiveness by helping families identify and utilize such strengths and supports. Another important finding is that the Vital Involvement Domain Scan tool can be used to identify relevant strengths and obstacles in individual family members and family systems that can be used to assess, plan, and evaluate progress toward client and family well-being. Our findings suggest that vital involvement, well-being, and healthy development are all possible in foster or adoptive families with children with special healthcare needs. This means that the child welfare system can and should promote vital involvement in families as a way to enhance well-being in children. As this case study has demonstrated, vital involvement offers concrete strategies for identifying and utilizing existing strengths to counteract problems and obstacles. Child welfare workers and policies could implement such strategies to provide meaningful supports to families and children. In an effort to get information out into the child welfare community about vital involvement and its strategies for promoting well-being, our next action step will be to partner with the Johnson family to create user-friendly manuals that identify family strengths, environmental strengths and supports, and strategies for utilizing these to overcome challenges and obstacles. We will create a manual to provide families with children with special healthcare needs involved in the child welfare system a roadmap for navigating the system or systems within which they find themselves. The manual will include tips, cautions, examples of strengths and supports, and vital involvement-based suggestions for using all of these to promote well-being in children and families. We will also create a second manual for child welfare workers that will include resources, strategies, and problem-solving tips to help them maximize strengths, provide supports, and minimize barriers in clients' families with children with special healthcare needs. If you would like to learn more about anything mentioned in this presentation or the work being done in these areas by Helen or Courtney, please feel free to contact us. Thank you for your time, and we hope you learned something new, exciting, and useful.